guys, my name is Nina Crawford, and this is episode 2 of Let's Talk About It. Today I'll be interviewing Dr. Archer, and we will be discussing how COVID-19 has disproportionately affected the Black and Brown community. What do you think about the changing class system within the middle class system between essential workers and those who have been unemployed?
I think what's happening in front of our eyes, across the nation and maybe throughout much of the world, is this glaring light that is being cast upon the structural inequities that have been part of the United States for quite some time, and those individuals that have to work on what we now calling the front lines, and our those who work in our transportation fields and those who work in throughout our healthcare system in a number of different capacities, and those who work in maintenance and facilities and janitorial types of work cannot leave those jobs, right? And if you are deemed essential and have to have constant interaction with the outside world, then what we've seen here, the data suggests that you're at greater risk, right? That you're at greater risk to contract the virus, to spread the virus, to be a carrier of the virus. And, that question for me about the changing scope of our class structure now during this COVID-19 pandemic really in many ways exposes a trajectory that the country has been on for quite some time. And it's just glaring that we see it now, those who do not have the luxury of working from home.
Right.
They have to be out there in these service industries. And I think what's clear is those who were staggering on the fringes, many of those folks obviously now struggling in really glaring ways. So it's a light that is being cast upon structural inequities, and it's something that we're all having to confront with and deal with now, because it's in front of us in ways that it's never been before.
Excellent. Okay. So in areas that are predominantly Black and Brown, such as the Bronx, Brooklyn, Harlem, Queens, in what ways can we make a difference to aid them?
The effects of these structural inequities are Black and Brown individuals disproportionately being affected, disproportionately dying as a result of the COVID-19 pandemic, that their numbers are really high in relationship to their population demographic numbers, right? So they constitute minority populations in these areas, at least where the data is being collected, and that's the point I want to get to. But yet they're suffering and struggling at disproportionately high rates, which is not really anything new. I mean, if you look at what happened, I don't know, I'm thinking during the 1930s, right after the stock market crashed in 1929, when the federal government, largely under the auspices of Roosevelt, came in with those New Deal initiatives, that did sustain and help African Americans to a degree, but it was disseminated unevenly, it was distributed unevenly, and there are a number of examples that are called to mind that echo and mirror much of what we're going through now. But I think when we really, the moment we're in now, Nina, thinking about the structural inequalities, the disparities across racial lines, I think it's important, and there are some senators who have pushed for this, who are at least calling attention. I think of Cory Booker, out of Jersey, uh, Elizabeth Warren, and I think it was Kamala Harris, who have talked about the need for greater transparency where we have high concentrations of brown and Black people, the need for greater transparency in collecting data, in collecting this data and analyzing this data as it relates to contextualizing it through a lens that considers race. So greater transparency when we're lending attention to how this data in connection to race, how does it inform policy? How might that inform medical systems? How might that inform greater community engagement and activism when thinking about the COVID-19 pandemic? So, I think I think if we can call attention to the data, right, because so much of it is anecdotal, and which is really surprising, that there are regions and states that are increasingly noting the data and collecting the data, but there are a number of regions, a number of states that are not. And so much of what's happening behind the scenes in these health facilities, in these communities, in these neighborhoods, we have some of the data, but so much of it is anecdotal. And if you have, and this is related to structural racism, if you had a pre-existing condition, or if you're a minority, particularly if you're brown or Black, we've seen some of the data that comes out where there have been times where they're not getting tested as much, right? Mm-hmm. And so I think if we're lending attention to what's happening, it's really important to collect the data and then to have full transparency about how that data is collected. That data informs policy.
We all know that the prison pipeline consists of predominantly Black and brown men, especially like on Rikers Island, stuff like that. What is your stance on the treatment of inmates during the COVID-19 crisis?
Yeah, I think that's a great question. I think, as you allude to here, it's a human rights issue, and if we're thinking about it responsibly as a human rights issue, which I believe wholeheartedly we should, I think it's important to think about the significant efforts of those who advocate for the public defenders groups, who have said that certain inmates should be released. Mm-hmm. Because they can't handle the surge. It's impossible to keep social distance. Many of these institutions, it's being reported that they don't have the equipment. And if you have an outbreak, and many of these people are going to come back to society, but if you have an outbreak, it's so hard to contain in an institution that is not medically equipped to absorb a pandemic like COVID-19. It really brings us back, not that we should have ever left, but it brings us back. It refocuses our attention to those who are incarcerated. Mm-hmm. And the rise of the prison industrial complex and some of the human rights issues that some of us have been talking about and paying attention for a long time, but now more than ever.
So what are your views on the current discrimination against African and African Americans in China, such as not allowing them into shops, refusing them from stores, evicting them from their homes?
One, is important to distinguish between the populace, the citizens, in their government. I think these distinctions aren't always clear, maybe not always visible because the two are often intertwined. And then when we think about the backlash that Chinese Americans have encountered as a result of the COVID-19 pandemic, and we challenge that notion as Americans, right? You know, based on our notions of equality, democracy, fairness, liberty. And when we look across the ocean and see a government response that is hostile to Africans or people of African descent, I think it's disheartening. I think we're disillusioned by that posturing, by the way the Chinese government is positioning themselves in that way, or at least responding to the pandemic and what is clearly an aggressive hostile posturing. I would hope that all individuals who are calling attention to our injustices here are also exposing the injustices everywhere. You know, because as we see now, Nina, we're more connected. I mean, we've always been connected, but our connections matter more now than ever.
That's it for today, guys. Make sure you are washing your hands, practicing social distancing, and make sure that you get your information from a credible resource.